Hello, my name is Bill Corder, and I'm a financial advisor at Manning Wealth Management. I will be speaking to you today about a very important topic that will affect almost everyone on the planet at some point during their life: long-term care. Throughout the next few minutes, I will attempt to answer some of the more frequently asked questions we receive from clients about long-term care and how to plan for it. We will identify what long-term care is, who pays for it, why long-term care insurance is needed, and how long-term care insurance works and some of its benefits. Let's start by identifying long-term care. Long-term care is described as providing care when a person is unable to perform activities of daily living like bathing, dressing, eating, toileting, maintaining continence, and transferring. In addition, onsets of dementia, senility, and Alzheimer's are cognitive impairments that can be classified as needing long-term care services. There are several ways to pay for long-term care services, including Medicare, VA, Medicaid, personal savings, and long-term care insurance. It is important to recognize the limits of each of these options. Let's examine Medicare first. Medicare will only pay for skilled and rehabilitative care if there is an expectation that the patient will recover, and only for a maximum of 100 days. Medicare does not cover custodial care at all. Custodial care is when a person receiving care needs assistance with activities of daily living or supervision, not treatment that can only be administered by a doctor or skilled nursing staff. About 95% of long-term care is of the custodial type and not covered by Medicare. You may also believe that military veterans can receive unlimited, free long-term care from the government, but only limited care is available. There are few VA nursing home facilities, and veterans who require long-term care as a result of service-related injuries qualify before all others. It is recommended that if you are a veteran, you contact your local VA facility to see what benefits are available to you. Medicaid coverage is typically limited to skilled nursing facilities, which amounts to about 0.5% of the type of long-term care people generally need. You also must meet state welfare guidelines in order to receive these benefits. Although this care option may seem tempting, it is important to remember that the Medicaid system has become overburdened and may not be a viable option when you need it, in addition to the fact that you must be first impoverished. Personal assets can cover all types of care. However, long-term care is expensive and may drain your savings, leaving you little for your family or your heirs. If you are considering this as an option to pay for the cost of long-term care, there are a few things to consider. The average national cost of care is approximately $75,000 per year in today's dollars, and health care costs are increasing at 6.5% per year. A few other questions you may want to ask yourself is, have we allocated enough funds to pay for our care when we get sick? And can we access these funds without destroying our financial plan or invading our principal? Long-term care insurance may be an affordable way to fund your care and protect your overall financial plan and your family. It works to protect you and your assets. Long-term care insurance covers care in a variety of settings, such as home care, assisted living care, adult day care, nursing home care, and hospice care. Premiums are a fraction of the cost of long-term care, and with proper coverage, you may avoid draining savings to fund your treatment. And just as important, a long-term care insurance policy protects your family members from the burdens of caregiving. Medical advances have enabled doctors to treat illnesses that used to be considered terminal. People can now live for long periods of time with heart problems, diabetes, and cancer, when in the past these diseases usually meant a shorter life. So whether you believe it could happen to you or not, the fact is you could live for some time with chronic illness or needing assistance. Given this, we should have a plan in place if something should happen to you. As you can see, whether you are a man or a woman, the chance of living into your 80s or 90s increases once you hit the age of 55. This is just another reason why you and your spouse need to establish a plan for long-term care. Statistics show that more than 2 out of 3 people 65 and older today will require extended care at some point in their life. And the average length of that care, almost 4 years, is the average length of the majority of long-term care insurance claims. The average life expectancy after an Alzheimer's diagnosis after the age of 70 is 4 to 7 years. Now, anyone who has gone through something like this with a loved one knows how draining it can be, financially and emotionally. More than 70% of care is provided by families or what is known as informal care. Of that, 67% is provided by their spouses, children, and grandchildren. This is often because most people have no other options, and they must rely on their families. Caregiving can be very stressful, and often the burden falls on 1 or 2 of the closest family members. Caregivers may suffer from physical, emotional, and financial problems as a result of giving care. Whatever the chances of needing care, don't you want to be protected? Today, the cost of long-term care in the United States can put financial stress on most families if they do not have a plan in place. And as you can see, 12 years from now, the cost of care will skyrocket out of control due to the increased costs of health care in the United States. So how does long-term care insurance work? These benefit triggers are uniform for long-term care insurance carriers. Most carriers require that you provide a letter from a healthcare professional certifying that you need help with 2 of the 6 ADLs or that you are significantly cognitively impaired. Long-term care insurance pays for all levels of care in all settings at a fraction of the cost of actual long-term care. Long-term care insurance protects our retirement portfolio so that it can execute for the purpose for which it was intended, retirement expenses. Otherwise, we may need to divert retirement income and eventually invade principal to pay for our care. With Americans living longer and healthcare costs continuing to rise, it's more important than ever to have a strategy in place to shelter yourself from the risks that long-term care may present. Like most types of insurance, long-term care coverage is designed to protect your personal and financial well-being. But before you can decide whether it's an appropriate option for you, the first step is to be sure that you have a clear understanding of what long-term care actually involves. Most often, long-term care encompasses custodial care, as opposed to skilled nursing care, meaning the support and assistance a person receives with activities of daily living. These might include bathing, dressing, eating, toileting, and transferring. The necessity for long-term care, whether as a result of normal aging or due to an illness or injury, can create significant anxiety and stress for you as well as your family members and loved ones. While it may be difficult right now to imagine yourself ever needing help with such basic activities, the choice you make now can help ensure that you are able to maintain the independence you want later. And the younger you are, the more options you're likely to have available to address your specific needs. Long-term care coverage is a key element of any risk management strategy, not to mention an important component of a comprehensive retirement wealth management plan. At Manning Wealth Management, we take a highly personalized approach to creating a framework for ensuring your future with the relationship we maintain with you at the foundation. As your guide, we will take time to understand your unique priorities and wishes. This process may incorporate discussions about personal health issues or concerns. While we recognize that this can be unsettling, our goal is to identify alternatives that can provide the safety net you need and the flexibility you want at an affordable cost to you. We consider such things as the type of care you may require and your preferences about where you would like to receive this care, whether it be in your home or in an assisted living, adult daycare, or nursing home setting. We work with you every step of the way to help ensure that the process is smooth in order to develop a long-term care plan that's well coordinated with any other risk protection policies you may have and compatible with your overall financial picture. While there are countless options available, our goal is to find the ones that are right for your specific needs. Our status as independent financial advisors means you can be assured that every recommendation we make is in your best interest. We invite you to contact us today to learn how Manning Wealth Management can help you create a framework for ensuring what's most important to you.